Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to talk about a condition called dry eye disease or keratoconjunctivitis sicca, which is the proper name for this condition. So dry eye is a broad term for insufficient tear film, and we try to break that down into insufficiency of the amount of tear production or the quality of the tear production. So the tear production is a very, very complex thing. It's a combination of fluid, so pretty much like water. Um, there's an oily layer and there's what we call a mucin layer, and they're all produced by different structures of the eye. So the fluid layer is mainly produced by the what we call the lacrimal gland, which is in the top corner of the bony orbit, as well as the so-called third eyelid gland, which contributes about 30 to 40% to that tear production. And then there's other components such as the mucin layer, which is produced by the insides of the eyelids. We call that the conjunctiva. And then finally, the glands that make up the lid margin, we call those the meibomian glands. They make up the oily or the fat layer. And tear production is sort of a mix of all of these different components. And then there's also certain so-called receptors. We call that a glycocalyx, which is on the surface of the eye. So the surface of the eye isn't completely smooth. It has almost like little fingers which reach out and try to attach to this tear film, and that tries to tie the tear film onto the surface of the eye. And if we have dry eye, what we try to determine is, are we lacking the amount of fluid that the eye is producing, or are we lacking in the quality? Is that mix of fluid, mucin, and oil out of balance? So the majority of cases that we see with dry eye is a so-called immune condition, immune-mediated condition, or an autoimmune condition. The condition tends to happen later on in life. It's most likely there are most likely some genetic components as well to this, some hormonal changes. You can also get dry eye if you've got other conditions going on, such as if so in humans, particularly women who go through menopause can start experiencing dry eye disease due to the hormonal imbalances, and similarly, aging female dogs can undergo the same changes and also start developing dry eye symptoms. There's also medications which can cause dry eye disease, as well as other systemic conditions, so conditions involving the whole body, which can trigger this condition. There's a certain subset of dry eye called neurogenic dry eye as well, which means that the nerve which supplies the gland that produces the tear production isn't working properly. And that can be triggered by many different things. It can be an inflammation of the nerve. It can be a tumor potentially, which is pressing on the nerve. So it can be a whole array of different conditions. In most cases, there is a degree of dry eye in both eyes, although there are some cases where it's only in one eye and the other eye is perfectly fine. There are some patients who are born with insufficient tear production or tear producing structures, in which case it can affect either one eye or both eyes. Um, so it's not that you can't generalize whether or not it's always a bilateral condition, but most of the cases that we tend to see have it worse in one eye, but they usually have some degree of dry eye in both eyes. Yes. Well, we tend to see a lot of English bulldogs with dry eye conditions. We also see tear film imbalances, particularly in our short-nosed patients, such as pugs, French bulldogs, Lhasas, Shih Tzus. And we see a number of West Highland White Terriers which have really, really severe dry eye disease later on in life. And in those cases, it's usually some sort of a genetic or immune mediated condition. So this is a condition which is mostly managed with medications. Luckily, there's a lot of medications that we can choose from. So medications such as Optimune is the to-go-to medication that we tend to start off with. If that is insufficient and doesn't work well enough, we sometimes have to change it for a different medication, such as tacrolimus or Protopic. Again, they're there for the same purpose, so they're there to help stimulate the tear production and sort of suppress the immune system in that location, and they tend to work very well. These types of medications don't work very well if there's a nerve problem, such as in so-called neurogenic dry eye disease, just because they target the wrong thing. So we're not targeting the nerve with these types of medications. We're actually targeting the immune system in that gland. With conditions such as neurogenic dry eye disease, we have to use different types of medications, such as pilocarpine, which is just a different type of drug. Um, and that can either be given as an eye drop or as a medication by mouth. And it can take several weeks, in some cases, several months for that to start producing tears. In some cases, tear production never completely comes back. If medical treatment fails. So we usually start off with medication, regardless of what the cause is. And medication doesn't work from one day to the next. It can take several weeks to potentially even several months to have adequate tear film, and we may need to change treatment round during that time several times. So it's a very, very long term, unfortunately, very frustrating condition. But if medication doesn't work at all, the only other treatment option that we have available for this is a so-called parotid duct transposition. It's essentially a procedure where the the duct from a gland that ends up in the mouth, so the one of the salivary glands, is redirected into the lower into a part of the lower eyelid to help lubricate the eye. The problem with that particular type of surgery is that um, saliva doesn't have the same properties as tear production, so a lot of these patients end up having quite a lot of mineral buildup in the cornea. They can have chronic ulcers. They can sometimes start developing quite significant scarring in the cornea. So um, it's not an ideal type of procedure, but in patients where there's absolutely no tear production whatsoever, and they are very, very painful, it's a salvaging procedure that we can perform to try and save the eye. So dry eyes is a very uncomfortable, very painful condition. It's probably similar to having an air condition blow in your face, and then having that sensation of severe dryness. Some people compare it to having sand in their eyes. Some people wear contact lenses compare it to wearing a dry contact lens on the eye 24/7. So it's a very, very uncomfortable condition, and humans who have it will be able to confirm that it's a not very comfortable condition to have. So leaving it untreated is not really ethical if for whatever reason that patient is not responding to medication, is very painful. In some cases that eye might need to be sacrificed. But the vast majority of cases, if you catch them early, tend to respond to medication fairly well. So hopefully you found this video useful. If there are any further questions or comments, feel free to drop them at the bottom. Thank you. Bye-bye.